Ken Landa. Thanks for watching. Let's talk about Zyprexa or olanzapine. This is a second-generation atypical antipsychotic that was patented in 1971 and approved by the Food and Drug Administration in 1996 for treatment of schizophrenia. And over a period of time, it's also been approved with fluoxetine for treating people with depression, and it's also approved for treating people with the mania of bipolar disorder. The drug went generic in 2011. For schizophrenia, it's approved for people age 13 and up. For mania, again, age 13 and up. People who have mania that's being treated but haven't really gotten completely better with either valproate or lithium, it's approved as an add-on therapy, an adjunctive therapy. Second-generation atypical antipsychotics are a large group of medicines that include Abilify and Risperdal and Seroquel and Invega and Latuda and Vraylar and Saphris and Geodon and now Rexulti. The American Psychiatric Association doesn't take a position on which drug a person should use. However, they do say that you should use the lowest possible dose because the drugs are associated with a significant number of side effects. The drugs are used off-label quite frequently, off-label for indications where there's not really great evidence that the drugs are of benefit. For instance, they're used to treat eating disorders and panic attacks and generalized anxiety and delusions of parasitosis and post-traumatic stress disorder and Tourette Syndrome and stuttering and hyperactivity, used for aggressive behavior or the repetitive behaviors associated with autism or insomnia, or the nausea and vomiting associated with chemotherapy, available in 5 and 10 and 15 and 20 milligram oral agents, also available as an intramuscular injection, an injection for people who have schizophrenia who are out of control or people who have mania that's out of control who need relatively quick onset of action, onset of therapy, also available as an oral disintegrating tablet, and now as a long-acting injection, intramuscular injection. It's considered first-line therapy for the mania of bipolar disorder, but probably only a second-line therapy for maintenance of the suppression of the mania. Schizophrenia, the starting dose is 5 to 10 milligrams. The target dose is 10 milligrams. In bipolar disorder, it's 10 to 15 milligrams for the mania. On the other hand, if a person is already receiving lithium or valproate, maybe 10 milligrams is a more appropriate dose. It seems that we use a lower starting dose in individuals who are either debilitated or pharmacologically sensitive, or people who are prone to hypotension, low blood pressure, people who have slow metabolism. The largest part of the antipsychotic effect in schizophrenia generally occurs within the first week of therapy. After that, the improvement's relatively minimal. So if a person isn't significantly improved by 4 to 6 weeks, then we should consider switching to a different medicine so long as the person has been compliant with therapy. A lot of people with schizophrenia don't follow through with their therapy. In schizophrenia, the acute treatment is certainly better than placebo, and it seems that maintenance therapy is associated with fewer recurrences than switching people off of the medicine. So even though they seem to be better, it seems that ongoing therapy might be more appropriate. There's some argument about that nowadays. The medicine seems to be better for the positive symptoms of schizophrenia. Positive symptoms of schizophrenia are the agitation and hallucinations and delusions, better than for the negative symptoms, the apathy or the social withdrawal or the blunted affect. Most of the trials have been conducted by the drug companies. They've had a lot of discontinuation of therapy. The trials are relatively short-term. In one study, looking at all of the data available in 2013, comparing 15 different antipsychotics, they found that Zyprexa was third overall in efficacy, or the effectiveness of the drug. It was better tolerated than some of them. It was slightly more effective than Risperdal, moderately more effective than Haldol and Seroquel and Abilify. But it was about a third less effective than clozapine. But clozapine has a variety of other side effects. Unfortunately, a lot of people who are receiving Zyprexa or the antipsychotics receive polytherapy, multiple different drugs. That's not such a good idea because of the lack of additional benefit, but the increase in the incidence of side effects. Now, when we're treating schizophrenia, about a third of the people are not going to improve with the first generation or the second generation drugs. Those are going to be treatment resistant, and it would appear that that's when the clozapine seems to be most effective. It improves about 50 to 60% of them, but it's associated with significant number of more serious side effects, including stopping the blood cells from being formed and significant weight gain and salivation. So if we're talking about treating the individuals who have mania, it would appear that lone therapy with Zyprexa is okay. And some of the studies have shown it's better than placebo, but some of the studies have shown it's not really better. On the other hand, in people who are already taking the valproate or the lithium and haven't received significant amount of benefit, then it would appear that adding Zyprexa is better than just continuing the valproate or lithium by itself. Now, for treatment-resistant depression, we have what's known as augmentation therapy. So we use typically slightly lower doses than we would use with schizophrenia. And drugs that are commonly used to treat treatment-resistant depression would include Zyprexa and Seroquel and Abilify and Risperdal. The Zyprexa, of course, combined with fluoxetine is approved for the purpose, and so is Rexulti, another medicine that's in the same family. Now, unfortunately, all of these drugs, especially the Zyprexa, have significant side effects. So the side effects are increase your blood sugar, make you diabetic, cause diabetic ketoacidosis or hyperosmolar coma. And the risk as far as these conditions may be greater with Zyprexa than with the other atypical antipsychotic drugs. Increase the blood pressure a little bit, or in some people, a whole lot. And as a matter of fact, in 2004, the American Diabetes Association said Zyprexa caused more diabetes than any other widely used antipsychotic. And that caused the FDA in 2013, much delayed, to put on the label a warning that, hey, this drug might increase your blood sugar. It also might increase your triglycerides by as much as 50 points or even more in about 60% of the people after 1 year of therapy. Increase your cholesterol by 40 points in about a third of the people. Increase weight by an average of 6 pounds on a short-term basis. On the other hand, if we look at a longer term, the average weight gain is going to be about 12 pounds. So we find that at 1 year of therapy, about a quarter of the people aren't going to gain any weight, a quarter of the people are going to gain up to 11 pounds, a quarter of the people are going to gain between 11 and 25 pounds, and a quarter of the people are going to gain probably more than 25 pounds. So significant weight gain associated with this medicine. Now, side effects, the common side effects, are postural hypotension. You stand up, your blood pressure goes down. You get constipated. Weight gain, I mentioned, dizziness and dry mouth and tiredness, erectile dysfunction in men, personality disorders, non-aggressive type objectionable personalities, and feeling of restlessness and sedation and headache. And then there's the tardive dyskinesia, the movement of the face that goes like that, or the eyebrow that goes like that, or the fingers that are doing the same sort of thing, the dyskinetic movements. Anybody taking the drug. And there's a greater risk with the higher dose, greater risk with the longer period of time. So we like to use the lowest dose for the shortest period of time. And people who have seizures might find that they have an increased frequency of seizures, or people who are prone to seizures, maybe because they have Alzheimer's disease or some other kind of condition, well, may have more seizures. And it causes some problems with falls and fractures and dysphagia. So it's difficult to swallow, and people can aspirate, and aspiration pneumonia is a relatively common problem, especially in people who are older, especially in people who have Alzheimer's disease. And the postural hypotension I mentioned, that's the low blood pressure, well, that can cause some dizziness and fast heart rate, and some fainting, especially during the initial titration. And you have to be especially cautious if you have some sort of cardiovascular disease, cerebrovascular disease, a history of a heart attack or a stroke or heart failure, conduction abnormality of the heart, if you're dehydrated, if you're on antihypertensive medicine, all of those make the drug a little bit more risky. It also can cause Parkinson-like reaction where you have a masked face, don't seem to move the face very much, no expression, the muscles become rigid, maybe a tremor. Peripheral edema may develop, urinary incontinence. People can develop constipation. Sometimes you can have problems with glaucoma if you have a narrow angle or if you have a tendency towards slow bowel movements. Well, may well develop a paralytic ileus. And there is some problem with the blood cell formation, so that agranulocytosis that's much more common with clozapine may occur with Zyprexa. And elderly people who have dementia-related psychosis have an increased incidence of death from transient ischemic attacks and stroke. The drug seems to be maybe able to increase the incidence of suicide or thoughts of suicide. So people should be given the smallest number of pills possible, and it may cause a condition that we call the neuroleptic malignant syndrome. This is associated with increase in body temperature that increases the heart rate, increases the sweating, and that can cause muscle breakdown and myoglobin in the urine, and then that can cause renal failure. You have to be careful in hot tubs and strenuous exercise and hot days. And it can cause a drug reaction itself and lead to hepatitis or pneumonitis, inflammation of the lung, inflammation of the heart, myocarditis, and prolactinemia. About a third individuals develop more prolactin. And if it's taken by a prepubertal boy, well, it might develop increase in breast tissue, female breast. We call that gynecomastia. And women might develop, and men too, might develop some galactorrhea, production of milk. And it may be associated with a decrease in the gonadal sex hormones, so a decrease in the estrogen, a decrease in the testosterone, and in women, certainly that can lead to amenorrhea and lack of bone mineral density. And interestingly, at least in laboratory animals, it may be associated with breast cancer or mammary cancer. And we know that in humans, a third of the breast cancers may have some dependence, at least in vitro, on prolactin. So there's a potential problem, potential theoretical problem. Well, there's also the potential for disordered thinking, cognitive impairment, poor motor impairment, poor motor judgment, poor motor abilities, difficulty driving a car, difficulty operating heavy machinery. There's a black box associated with it as far as increased mortality in patients who have dementia-related psychoses. In just 10-week study, atypical antipsychotic drugs increase the likelihood of death by about 60 or 70%. That sounds like a lot, and it certainly is a lot, but it goes from 2.6% to 4.5% with Zyprexa, and deaths are mostly from cardiovascular disease, heart failure, or sudden cardiac death, or infections with pneumonia. Well, there's another problem. If you discontinue the drug, and you acutely discontinue the drug, you're going to have other kind of symptoms. And you have compensatory changes in a lot of different, very important chemical pathways in the body, as far as dopamine and serotonin and the noradrenaline and the histamine. There are no specific guidelines to get people off of these drugs, but we do know that even if you were taking the drug for a disease or a condition unrelated to schizophrenia, it might cause a schizophrenia-like reaction when you discontinue the drug. The good news is that the drug seems to have somewhat less side effects, somewhat fewer side effects, as far as the restlessness and as far as the extrapyramidal syndrome, the tremor or the mask-like faces compared to the other atypical antipsychotic drugs. The problem is that with Zyprexa, there's more weight gain, greater increase in the cholesterol and the triglycerides and the blood sugar. Probably about 10 to 15% of the people are going to discontinue the drug because of the side effects. While people are taking the drug, we need to monitor them, monitor the blood count, monitor the liver function, monitor the sugar, monitor the triglycerides and the cholesterol. And we know that at least if we use the injection form, there's a rare condition that comes with the long-acting injection. That's the depot intramuscular injection. About 2% of the people are going to develop a problem where it rapidly increases in the blood, gets into the blood instead of into the muscle. And when it does that, it can cause delirium and confusion and difficulty speaking and uncoordinated movements and sedation and generalized discomfort. So as a result, the Food and Drug Administration says, hey, if you're going to get the intramuscular injection, stay in the doctor's office for at least 3 hours after you've received it. And it can interact with a variety of other drugs. So it can interact with Tegretol and Levodopa and Rifampin and even Nexium and Cipro and some of the HIV medicines, and can cause that orthostatic hypotension where your blood pressure goes down, especially if you happen to be taking blood pressure reducing medicine, or if you're taking alcohol, or if you're taking Valium, diazepam. There's no problem if you also happen to be taking warfarin or lithium or valproate. That's okay. Well, interestingly, in the United Kingdom in 2004, the Committee on Safety of the Medicines, they said, hey, guys, if you prescribe either Zyprexa or Risperdal, you got to be careful. They're not for elderly patients with dementia. Well, then they did another follow-up study in 2008, and they found that the doctors were ignoring them. Pretty much the same thing happens here in the United States. The way the medicines work is the medicines seem to work on the receptors for dopamine and serotonin, and somewhat on histamine and noradrenaline, and they seem to even work on the GABA, the gamma-aminobenzoic acid. Well, there's a relatively small window where the drug fits in. Lower than that, it doesn't work. Higher than that, causes too many side effects. So if we talk about use of the drug in pregnancy, only if the benefits are greater than the risks, because there's the highest placental exposure compared to any of the other atypical antipsychotics. So in the 3rd trimester, if a woman's receiving the drug, the fetus, newborn, is then going to have likely withdrawal symptoms: agitation, hypertonia, hypotonia, tremor, or somnolence, maybe some difficulty feeding or respiratory distress. It can be either short-term or relatively long-term. There's no teratogenicity, but there seems to be fetal decrease in the weight. There's prolonged gestations, at least in animal studies. In nursing women, well, there's going to be some that's present in the breast milk, so it's probably not appropriate, although the dose is relatively small, and the safety has not been established for children. Overdoses are possible. Overdose, you could have drowsiness or slurred speech or agitation or aggression or difficulty with talking or increased heart rate, or it can slow your movements down or decrease the consciousness, anywhere from sedation to coma, lead to an increased incidence of cardiopulmonary abnormalities and arrhythmias and aspiration. It's considered moderately toxic compared to other drugs, compared to Seroquel or Abilify or the SSRIs, but it's less toxic than, say, the MAO inhibitors or the tricyclic antidepressants. The good news is you can take the drug only once a day, take it with or without food. It's well absorbed, maximum concentration within 6 hours. It's metabolized from what we call the first-pass metabolism. So 40% is metabolized before it reaches the systemic circulation. The half-life of the drug is about 30 hours, steady state in your system after you've taken it for about a week. About 60% is going out in the urine, 30% going out in the feces. Well, if you have liver impairment, hasn't really been well studied. If you have kidney impairment, no significant problem with taking the drug. Geriatric patients over age 65 ought to take about half of the dose. The clearance seems to be reduced by about 30% in women compared to in men. No change in the side effects, no need to alter the dose. Cigarette smoking increases the clearance of the drug by about 40%. In other words, it decreases the amount in your system. African Americans have an increased metabolism of about 25%, but no reason to change the amount of drug being used. Well, a study looked at the difference between the 1st-generation drugs and the 2nd-generation drugs. I really didn't find any difference. No significant improvement in psychiatric symptoms, no improvement in the quality of life, no difference in the negative symptoms or the cognitive impairment. Originally, it was thought that the second-generation drugs would have less tardive dyskinesia than the first-generation drug. That's a major complication. But that was found probably not to be the case. And most of the studies that have been performed with industry funding, in other words, the drug companies fund the studies, it shows the benefits are a heck of a lot more than when the government funds the studies. Second-generation drugs don't seem to have all that much benefit. Drugs are major sellers. Actually, in 2006, they were the 5th largest family of drugs. Sales of Zyprexa itself go from $1.5 billion to $3 billion over a period of time. Actually, it's brought in over $37 billion, just this particular drug. Had a lot of lawsuits against it, lawsuits that said that the company knew that it could increase the body weight, knew that it could cause diabetes, but didn't say anything about it. Other lawsuits had to do with the drug being promoted for people who had, quote, schizophrenia, but really were just older people with dementia, or even younger women who required less sleep or were more talkative or seemed to be elated. The company has settled a large number of lawsuits for a major amount of money. How much does it cost if you want to take the drug? Well, if you want to take the drug 10 milligrams for 30 pills, you could go over with cash to a pharmacy. It would be somewhere between $150 and $200 unless you go to Walgreens or CVS. CVS, it's about $400. Walgreens, it's close to $600. With a coupon from GoodRx, it's only $14, except if you go to CVS and Walgreens, it's going to be about $112. The brand name drug costs about $700. So with Zyprexa, we have a treatment for schizophrenia, it's for the mania of bipolar disorder, and maybe with fluoxetine for treatment-resistant depression. Seems to work okay, but it has a lot of side effects including weight gain, and diabetes, and high cholesterol, and tardive dyskinesia, and a variety of movement disorders. So proceed with caution. And if you're taking the drug for anything other than one of the major areas where it's been approved, then maybe get a second opinion to see if the drug really is for you, because unfortunately these drugs are widely prescribed nowadays and have an awful lot of side effects. So anyway, thanks for watching. Hope you enjoyed the show. If you did, tell a friend. Maybe consider subscribing so you get all the information about new videos that we post. Appreciate your interest. I'm Dr. Ken Landau. Thank you.